your Houston chiropractor, Dr. Gregory Johnson, and today Carlos has been kind enough to let us show you what a follow-up examination looks like for a patient suffering from herniated disc. Now, I know you saw Carlos's initial videos regarding his herniated disc, so today we're going to re-examine him and find out if he has any issues going on, what improvements he's made, and to chart our course of treatment following that. So let's flex you here before the mirror. First thing we're going to do, as always, is check posture. So let's have him hip forward and backwards. And his head posture is up and back a lot better today. He's still got a little high left shoulder because his head and neck are translated to the right on the x-axis. The pelvis is right down the center today, though, so that's good. No translations either way, no rotations. So much improved posture. Now you can open your eyes. Next thing we're going to do is a flexion test. Go ahead and bend forward and tell me when you start having pain. Right there. So he has pain right there. It's about 45 degrees. Yeah. And it also pulls down into his buttocks region, sacroiliac, down into the left leg. Now backwards. No pain whatsoever. Full range of motion. That's good. Tilt left. No pain. Tilt right. No pain. Great. And now twist left. Little pain on that left side. Okay. Now twist right. Turn right, I mean. Is it okay with that one? Yeah. So everything's on the left side doing that. Now I'm going to have you cross your arms up over like this. And we're going to lean you backwards. And I'm going to twist you and push down. Does that cause any pain in here? Okay, he has a positive Temps test on the left. That's what this test is, an orthopedic test. How about this side? No pain on the right side. So we can still see everything's coming off this left side. So let's have you lay on your back right here then, Carlos. This is a very important test to do on all patients with low back pain to rule out any radiculopathy or sciatica from a herniated disc. It's called a straight leg raise test. Tell me if you feel any sharp shooting pain in your back or leg when I do this besides the pulling in your hamstring. Okay, so that's negative. I bring it down a little bit. Is that relaxed? Just let it go. Let me hold it. Okay. Then you sharply put the foot up. Is there any pain in your back or leg there? That's called a Braggart's test. So now we are going to do a psoas muscle test. I'm going to push down. You resist. Hold it up. Yeah, he's very strong on that, so that's better. Relax. And we're going to cross this over. This is a Fabri test to evaluate the hip joint and SI joints. Any pain doing that? Negative on the right. That's good. Now this is the bad side, so we'll see if this one's any different. Straight leg raise test.
Not right
on the left. Right, you feeling sharp pain?
Not extremely sharp, but...
Is there anything shooting down your leg?
Yeah, about right there.
Right there. Okay,
yeah.
So he actually does have a positive straight leg raise test at about 50 degrees, 60 degrees. So I'm bringing it down. Does that make it feel better down here?
Yeah, it's kind of falling asleep.
Okay, now how about when I do that? Do you still feel sharp pain in your low back or shooting pain?
No.
So he had a positive straight leg raise at 60 degrees, but he had a negative Braggart's, so that's good. Now we're going to test his psoas on the left side. I'm going to push down, hold it up. And he's increased his strength in that test tremendously. He couldn't even do that before, hold it up. Now we're going to do the Fabri test again on this left side. Is there pain in your hip or your low back? Yeah, now he's got a positive Fabri on the left, which still indicates some hip and left sacroiliac issues. Now we're going to test strength. Push. Good. Now pull. Good. Turn in. And turn out. Good. And do the same thing here. Push. Good. Pull. Turn in. And now turn out. Okay. He's increased his strength tremendously on this left side especially, and all the motor nerves coming out of the lumbosacral spine region, which is from L3, L4, L5, S1, all the way down. So that's improved in strength all through here. Next thing I'm going to have you do is sit up and face towards Renee, but get up sideways for us. There you go. Okay, now this is called a foramina compression test. I'm going to push straight down. Is there any pain in your spine anywhere? Okay, now this is a maximum foramina compression test. Is there any pain doing that?
No.
Okay, negative on that, and go to the left, same thing.
No.
No pain there, so those are all negative. Now tilt your head to the right. Any pain anywhere? No. Okay, now this is a shoulder depressor test. Any pain there?
No.
That's negative. This is a shoulder depressor test on the right. Any pain there?
No.
That's negative. So his foramina compression test and shoulder depressor test are both negative. That's great. We're also going to check his cervical brachial plexus. I'm going to push down, hold up. Good. Same thing here. I'm going to push down, hold up. Good. And I'm going to test his biceps. I'm going to pull out, hold. And I'm going to do the triceps. Hold. Good. He's very strong. There's a 0 to 5 grade on all these tests. Excellent. And he's all 5s everywhere except for his left foot in the internal-external rotation. Now this is very important because he has a lumbosacral neurological problem. And I don't know if you can get close enough here, Renee, to check this, but I'm going to be doing a... Just relax that right in my hand. There. Well, he's got an absolutely normal Achilles reflex now. You see that? Which came from 0 initially. Now we're back to +2 equal and active. We also should check those on his upper extremity while we're at it. That's good. Watch his fingers. Good. Excellent on the triceps. Biceps. Good. Reflex is an arc that occurs between whatever muscle I'm doing this on and the spinal cord directly back to that muscle. So it does not go up to the brain. It's just a reflex arc from the nerve to the spinal cord back to the muscle it's supplying. So we've got definite improvement there. Now I'm going to have him lay on his tummy for me, right here. And we're going to check out his leg length. Today his legs are exactly equal, so that's good. We're bringing them up, and do you feel this tightening up right in your lower back at all?
Right there.
Right there. So this is a positive knockless test. It's a negative Deerfield because he didn't have a short leg, or it didn't get longer or shorter when I brought it up. He still does have a left sacroiliac problem though right here. Is that a little tender?
Oh yeah.
Yeah, and then right here on the right, a tiny bit, but not as bad as the left. And then right down here at L5 is where the culprit is, because that was affecting his Achilles reflex on the left. It made it 0 when we first started seeing him. Now it's +2 equal and active, which is normal. Those are all still tender, aren't they, though?
Yeah.
All right, so now I'm adjusting his left sacroiliac as well as the femur trochanter on the left side. And then I'm adjusting his sacroiliac on the right in the x-axis and the y-axis, and straight down on the sacrum in the z-axis as well as the y-axis, moving the sacrum away from L5 to help that disc have more room between the L5 and S1 region of his spine. Now I'm adjusting these vertebrae, L5, now L4, there's L3, L2, and L1. Do some lateral stretching here that is